Welcome back again to Medical Bites for continued neurological assessments for physical diagnosis 2. Today we're going to be looking at cerebellar, upper motor neuron, vestibular, and corticospinal tract dysfunctional testing. For our first test today, we're going to be looking at the finger to nose test done bilaterally. This is to measure voluntary motor function and coordination. The provider will ask the patient to slowly touch his nose or her nose with an extended index finger. The patient's eyes are closed, head is in a neutral position. This is to check for coordination and cerebellar defects. Abnormality found with finger to nose bilaterally is called dysmetria. The physical exam should go something like this.
Okay, can you put your arms out to the side for me? Okay, and then with your index finger of your right hand, close your eyes, and then touch your nose. Good. And then with your left hand, touch your nose. Thank you.
Abnormal testing would look something like this. Either the patient will undershoot, overshoot, or not be able to find their nose at all. Similar to the finger to nose bilateral testing is the finger to examiner's finger. This is done with the patient's eyes open. The patient is asked to fully extend arm, touch their nose, and then asked to touch a provider's finger with their arm fully extended. Their hand should go from supination to pronation. This test can be done to increase the difficulty by moving the finger to many different locations or applying resistance. This is another test for cerebellar dysfunction and should look something like this. Go.
Okay, raise your right arm out to the side. Okay, I'm going to have you touch your finger to your nose, and then you're going to touch my finger. Okay. Good. Back to your nose. Touch my finger again. Back to your nose. Touch my finger again. To your nose. One more. Good. We're going to do the same thing with the left arm. So out to your side, touch your nose, and then touch my finger.
This test can be made more difficult by asking the patient to do it faster.
Okay. Do it faster.
Further testing for cerebellar dysfunction can be done with the rapid alternating movement test. This test can be done with the upper or the lower extremities. For our testing purposes, you will be asked to demonstrate both. Upper extremity is done with palms up with the back of their hands on their upper thighs while in a seated position. They are asked to then turn their palms down bilaterally, rapidly alternating from a position of supination to pronation and back. This exam should look something like this. Go.
Okay. Can I have you place both of your hands on your thigh? Okay, and then very rapidly pat your legs. Faster.
Abnormal testing will find that one hand will be not coordinated with the other while the patient tries to do the test. The rapid alternating movement testing for the lower extremities is asking the patient to move from plantar flexion to dorsiflexion in a rapid tapping motion of their toe. Again, this test is done bilaterally with a positive test being discoordinated movement to one side or the other. The exam should look something like this.
Okay. I'm going to ask you to tap both of my hands with your feet. Faster.
Abnormal testing, again, should be discoordinated. Abnormal testing is referred to dysdiaconesis. Now, isn't that a fun word? Further testing of lower extremities for cerebellar testing to assess for coordination of movement of the extremities can be done as well with the heel to shin test. In this test, the patient is seated. The physician asks the patient to place the heel of one foot to the upper tibia of the contralateral leg. They are then instructed to move the heel down the shin to just above the foot. This motion is assessed bilaterally. The heel to shin examination test should look something like this.
Okay, can you place your right heel onto your left shin just below your knee? And then advance your heel down your shin to your ankle. Good. And then we'll do the opposite side. So left hip.
Abnormal testing for the heel to shin test would be demonstrated by difficulty at approximating the heel to just below the knee or inability to move in a fluid motion. It would look something like this.
Okay, place your left heel onto your right shin just below your knee. And then advance down your shin to your ankle.
The Pronator Drift test is an indication of a subtle upper motor neuron disorder. It can also be present in inborn errors of metabolism. The patient is asked to hold his or her arms outstretched with the palms facing upward. The patient with arms outstretched then closes their eyes in order to accentuate the response, because without vision, the patient must rely on proprioception alone to maintain the arm position. The presence of an upper motor neuron lesion would have the supinators in the upper limb weaker than the pronator muscles. As a result, the arm drifts downward and the palm turns towards the floor. This abnormal testing would look something like this.
Okay, can I have you place your arms outstretched with your palms facing the ceiling? And then close your eyes for me.
A negative test for the pronator drift would find the patient able to hold both of their arms at extension with their palms up and would look something like this.
Okay, hold your arms out in front of you with your palms facing the ceiling, and then close your eyes.
The Babinski reflex test allows us to assess for upper motor neuron dysfunction. This test is seen as positive when you have abnormal extension of the great toe upon the testing. Toe flexion is normal. Remember that this test may appear to be positive in children even when they do not have an actual upper motor neuron dysfunction. The Babinski test should look something like this. Notice the subtle